Good afternoon, everybody. I will present you today uh, our development about the delivery of nucleic acids to the liver using novel redox sensitive and ionizable lipids that NOF Corporation developed. I will start with a brief introduction to the topic. Delivery of nucleic acids to the liver is an excellent strategy for curing metabolic diseases such as dyslipidemia, virus infections such as hepatitis B and C, and neuropathy such as amyloidosis. Lipid nanoparticles have been developed for delivery of nucleic acids to the liver. However, adverse drug reactions limit their clinical application. Therefore, molecular design is needed in order to minimize the toxicity of the technology and to broaden the clinical options for this technology. A key issue for reducing the toxicity of lipid nanoparticles is to increase their biodegradability, so they will disappear after they do their work, instead of accumulating in the cells and causing toxicity. So we developed a library of ionizable lipids. All of them have disulfide bridge, their polar heads, and we have optimized the structure of the amine groups, which could be chosen from three structures. One is a linear amine, one is a piperidine group, and the other is a piperidine group conjugated to benzyl propionate. And we can also vary the hydrophobic part by attaching different fatty acids or tocopherol succinyl. So the tertiary amines are important in order to complex the nucleic acids and encapsulate them in lipid nanoparticles. These lipid nanoparticles are taken by endocytosis, and the endosomes acidify when they mature from early endosomes and into late endosomes. And this triggers the protonation of these amines that mediate the proton sponge effect and release of the nucleic acid to the cytoplasm. In addition, we have the disulfide bond that responds to the redox potential. This bond is stable in the serum. However, the redox potential of the cell is significantly lower than in the blood. Therefore, this disulfide bridge is reduced, and the molecule transforms to in the cell to a charged single-chain surfactant that helps to dissolve the membrane. In addition, the degradation product has a free thiol group, which could be conjugated to glutathione and excreted outside of the cell instead of accumulating in the cell. Free nucleic acids are degraded fast in the serum. If we encapsulate them in lipid nanoparticles that are based on our coatosome-assessed lipids, then we can significantly prolong their stability. The lipid nanoparticles can also efficiently transfect different nucleic acids, such as pDNA and mRNA, in vitro. And we observed that the disulfide functionality is important for mediating efficient release of the nucleic acid inside of the cells. If we replace the disulfide bond with a non-cleavable bond, like a alkyl, then the release of the nucleic acid is drastically reduced. In addition, we also observed that with certain constructs, we can significantly exceed the transfection efficacy that is mediated by other transfection agents, such as lipofectamine messenger marks. Next, we evaluated the toxicity of the particles in vitro and in vivo. For this purpose, we encapsulated the cells with different cationic lipid, and we measured the cell survival. We observed that the SS lipid does not lead to cell death even at high concentrations. However, if we change it a little bit and exchange the disulfide bridge by a alkyl bond, then the toxicity of the lipid drastically increases, and it becomes similar to what is observed with other cationic systems, such as lipofectamine. In addition, we evaluated the toxicity in vivo by injecting the particles and monitoring the weight of the mice. So the SS lipid does not affect the body weight. However, other cationic lipids, such as delinium C3-DMA, lead to slight reduction of the body weight. In the next slide, I will show you one specific application of the technology for delivering of siRNA to the liver. And in order to achieve the best delivery efficiency, we have optimized the hydrophobic tail of the lipid. So we synthesized three coatosome SS lipid, one with myristic acid as a hydrophobic tail, one is with vitamin A, and the third one with vitamin E as the hydrophobic tail. We encapsulated siRNA against factor 7 that is produced predominantly in the liver. We injected lipid nanoparticles to mice, and we measured the knockdown efficiency. We observed that the coatosome SSE construct had significantly better delivery efficiency than other construct, and this is because it has high binding to apolipoprotein E. Next, we evaluated the polar head of the lipid. We synthesized a library of lipids where we changed the distance between the oxygen and the nitrogen from a distance of 2.8 angstroms and up to 8.4 angstroms. This also changed the pKa value of the amine from 5.3 to 6.2. This might seem as a small difference, but keep in mind that it's a logarithmic scale. Next, we formulated the siRNA in lipid nanoparticles with the different SS lipids that we synthesized. And we observed that by elevating the pKa of the amine group, we can significantly improve the delivery efficiency to the liver and the transfection efficiency. So coatosome SSEC has a pKa of 6.2, while the coatosome SSE had a pKa of 5.9, and therefore the knockdown efficiency is threefold higher in vivo. In addition, the transfection efficacy was drastically improved by elevating the lipid to siRNA ratio. Finally, we also chemically modified the siRNA in order to make it more stable, and this enabled us to further decrease the effective dose. I would like to summarize my presentation. So we developed the new ionizable lipids, the coatosome SS series, which have optimized tertiary amines for delivery of nucleic acids, and they have the disulfide bonds, which makes them significantly less toxic than other transfections agent. The coatosome SSEC contract was specifically optimized for siRNA delivery to the liver. The optimization of its hydrophobic structure enables us to achieve higher targeting in vivo. Finally, we have also other constructs of cotosome SS series for other applications. If you are interested, then please visit our poster number 73. Thank you for your attention. Do you have any questions?
Probably not for the moment. Too much.
Okay.